Mrs. Farhana, wife of Mr. Muzammal, 26 years of age, got her formal education up till BA, housewife, resident of Rahimia Khan, married from last 1.5 years, primary gravida. Her last menstrual period 9th January 2020 with regular menstrual cycle, making her expected date of delivery 16th October 2020 and her duration of pregnancy 31 weeks 5 days. Her blood group is B positive. She is presented on 17th August 2020 through the emergency department of Sheikh Zayed Hospital Himya Khan for the evaluation and management of the decreased hemoglobin level.
Raised hemoglobin?
Decreased. Decreased hemoglobin level.
Okay.
She conceived after one cycle of ovulation induction while having the normal menstrual cycle of 7 by 28 days and came to know about her pregnancy by missing her periods and later on confirmed it by urine pregnancy test at private laboratory, and she booked herself to a nearby private clinic and her ultrasonography was performed and she was reassured about the fetus. However, her blood pressure was not checked at that time and blood test was not done. She was prescribed with tablet folic acid, which she took regularly. There is no history of excessive nausea, vomiting, fever with flu-like symptoms, rash, vaginal discharge, bleeding, burning micturition, and antifolate drugs like methotrexate and.
Hello.
हाँ जी, अब आ रही है आवाज?
हेलो
हाँ जी डॉक्टर फरजाना.
हाँ जी
आ रही है ना?
तुम्हारी आवाज गई. हाँ आ रही है.
She felt quickening at the 5 months of gestation. Her anomaly scan was not done. She has regular antenatal visits and her blood pressure. आ रही है कि नहीं? हेलो.
आ रही है.
हाँ आ रही है आशा.
अच्छा ठीक है. Her blood pressure was normal and she was prescribed with. ठीक है मैं पढ़ रही हूँ. And she was prescribed with iron and calcium which she took regularly. There is no history of polyuria, polydipsia and polyphagia, headache, blurring of vision, epigastric pain, right upper quadrant pain and edema of the hand and feet. Weight loss, weight gain, heat and cold intolerance. There is history of easy fatigability, generalized weakness, palpitation and shortness of breath. But there is no history of chest pain radiating to the left arm, orthopnea, proximal nocturnal dyspnea. Her diet is insufficient with meat, fresh fruit and milk, and there is no excessive intake of tea, coffee and chocolate or cola drinks. There is no history of easy bruisability, bleeding from the nose, mouth, gum and any other side, blood transfusion previously, chronic indigestion, pica intake, perianal itching and passage of the worm in the stool. There is no history of high-grade fever with yellowish discoloration of eyes and skin, low-grade fever with evening rise of temperature and decreased urine output. And there is no history of overcooking of food. She did not receive tetanus toxoid prophylaxis and there is no history of lower abdominal pain, vaginal discharge and bleeding. For this complaint, she visited to the Sheikh Zayed Hospital in Himya Khan and was admitted, and her blood test and urine test was done and she was told her HB was 5 gram per deciliter and she receives 1 unit of PEG cell transfusion. Her ultrasonography was performed and according to the patient, it was reassuring, but she did not tell about the exact duration of pregnancy at that time. However, her further plan of management was not discussed with the patient. Her age of menarche is 13 years with regular menstrual cycle of 7 days after every 28 days. She soaks 4 to 5 homemade sanitary pads. There is no history of dysmenorrhea, dyspareunia, intermenstrual and postpartum bleeding. Couple never practiced any method of contraception and pap smear was never taken. There is no history of hypertension, diabetes, asthma, tuberculosis, chronic liver and renal disease in her family. However, her father and brother is asthmatic. There is history of twin gestation in her family, but there is no history of congenital abnormalities and blood transfusion and thalassaemia in the family. She is non-smoker, non-addict with normal bowel and sleep habits with no known drug and food allergy. She took tap water and there is no history of barefoot walking. Her husband is a driver and earns about 18,000 per month. She lives in a rented flat of about 3 rooms and 9 family members and meet with daily necessity of life with difficulty. On examination, a 26-year-old female, well-oriented in time, place and person with height of 160 centimeter and weight 46 kg, making her BMI of 18 kg per meter square with following vitals. Her blood pressure is 110 by 70 millimeter of mercury. Pulse is 88 beats per minute. Temperature is 98 degree Fahrenheit and respiratory rate is 14 beats per minute. She is markedly pale but there is no jaundice, clubbing, tylonictia, leukonictia, palmar edema, and angular stomatitis and flattening of the tongue. Orodental hygiene is satisfactory. Thyroid was not enlarged. All accessible lymph nodes were not
Hello?
palpable, and there is no pedal and sacral edema. हाँ जी आवाज आ रही है?
ये आ
हेलो
रही है, आ रही है।
ठीक, there is no pedal and sacral edema. Bilateral breast examinations, bilateral breast are symmetrical with normal areolo nipple complex with no lamp palpable in all the four quadrant of the breast. Normal vesicular breathing with no added sound. Apex beat palpable in the fifth intercostal space in the mid-clavicular line, and first and second heart sound are of normal intensity with no added sound. On abdominal examination, abdomen is protuberant with central inverted umbilicus moving with respiration. There is no visible vein, pulsation, star mark, but sty gravidarums are present, and hernial orifices are intact. Abdomen is soft, non-tender, and symphysium of underlight is 30 centimeter with longitudinal light cephalic presentation. And lighter seems to be adequate. Estimated fetal weight is 1 to 1.5 kg, and fetal heart sound is 150 to 160 beats per minute. हाँ जी हो गया.
Investigations.
Investigations. 8 minute में भी मांगती हूँ आपसे पेज खोलूं. First of all, मैम blood group RH factor.
A positive.
A positive. Complete blood examination with date, including hemoglobin in gram per deciliter.
Count.
Complete blood count with date.
Done on 18th August.
18th August.
Hemoglobin is 6 gram per deciliter.
ठीक है. TLC per cubic millimeter. Total leukocyte count per cubic.
Count is 9,000.
Platelet counts per cubic millimeter.
180,000.
80,000. This is pre-transfusion or post-transfusion?
Pre-transfusion.
Pre-transfusion. ठीक है. RBCs, indices, and red cell morphology, including mean corpuscular volume.
जी MCV 60 जी बेटा
60. MCH, mean corpuscular hemoglobin.
मोहम्मद बेटा भाई को लिप्स दो, जाओ दे देते हैं.
MCH
27.
27. MCHC
35.
35. ठीक है. MCHC नॉर्मल आ गया. सीरम फेराटिन
12.
सीरम फेराटिन 12 है. ठीक है. और HB इलेक्ट्रोफ्रेसिस
Not done.
not done. Hepatitis B surface antigen anti-HCV.
Negative.
Urine complete examination for microscopy and biochemistry. Microscopic pus cells.
4 to 6 per cells.
कितने?
4 to 6.
Good. Good. 6.
4 to हेलो
जी जी आवाज आ
हेलो.
रही
हाँ
है.
जी.
जी डॉक्टर आसपास.
हेलो.
हाँ जी.
यूरिन बायोकेमिस्ट्री.
What you need on biochemistry?
Protein and sugar.
Nil.
Nil. Urine culture and sensitivity.
Not available.
Stool for ova and cyst.
Not done.
Not done. Obstetrical ultrasound, including dating scan with date.
We'll discuss later.
Anomaly scan with date,
Okay. No gross fetal
including fetal
anomaly.
anomaly. Recent scan with date.
We'll discuss later.
ठीक है. हाँ जी. On summarizing my case,
Summarize.
26-year primary gravida at 31 plus 26-year primary gravida at 31 plus 5 week, admitted for the evaluation and management of decreased hemoglobin level. She is markedly pale. Her symphysial fundal height is 30 centimeter, longitudinal-like phallic presentation. 5 by 5 had 5 by 5 palpable and lighter seems to be adequate. Estimated fetal weight 1 to 1.5 kg and fetal hearts 150 to 160 beats per minute with iron deficiency anemia and UTI.
Okay. What is your provisional diagnosis?
प्रोविजनल डायग्नोसिस तो इसमें मेरा जो है ना आयरन डेफिशिएंसी एनीमिया ही बनेगा.
How iron
Timing
deficiency
irregular.
anemia?
एमसीबी जो है ना वो 60 है, लेकिन एमसीएच जो है ना वो 27 से 33 पिकोग्राम होता है, तो मतलब लोअर लिमिट पे ही है उसका.
Okay.
फेराटीन जो है ना वो 12 है, ठीक है. 15 से 300 फेराटीन नॉर्मल होता है, तो 12 है, तो ये भी उसी की फेवर में जा रहा है.
You
एचबी
can
इलेक्ट्रोफोरेसिस बात
justify
हुआ
in
नहीं.
English.
Because MCB is 60 femtoliter, MCH is 27, normal range is 27 to 33, it is in lower range. MCH is within normal range and serum ferritin is 12, that is less than 15 to 300 is normal level and it is less than 15. So
Okay.
these points are in the favor of iron deficiency anemia.
What is your interpretation about MCHC?
MCHC is normal.
नॉर्मल है.
Okay.
नॉर्मल है तो ये तो वो नहीं मतलब
How you
थैलासीमिया नहीं मतलब.
differentiate
30
thalassemia and iron deficiency anemia on the basis of indices? Why you ask the
in,
indices?
because I have to differentiate between the and I also need the red cell morphology.
Okay, but why you ask the indices?
Because I have to differentiate between the iron deficiency anemia, thalassemia,
And what are
different type
indices
of
in
anemia.
iron deficiency anemia and what are values in thalassemia?
Iron deficiency anemia, MCV, MCH, both are decreased. MCHC is also decreased and serum ferritin is less than 15.
Okay.
While in
What about
thalassemia,
thalassemia?
MCV and MCH is decreased. MCHC remain normal within normal limits, and HB on HB electrophoresis there will be more percentage of HbA2.
Okay. Then what are indices of your patient?
Indices of my patient is MCV 60 femtoliter, MCH is 27, MCH is 35, and serum ferritin is 12.
Okay.
And
Then what is your interpretation? Okay.
on
Ferritin भी
these,
नॉर्मल है,
What is
MCHC
cause
भी
of
नॉर्मल.
iron deficiency in your patient?
what is cause of iron deficiency in your her dietary decreased dietary intake? She never took meat, fruit, and milk.
Okay. How much iron is present in human body stores?
Stores में 1000 milligram.
And how much iron is required during pregnancy?
2.3 in the first milligram per day in first trimester and in up to
Total
6.6
iron
milligram per
requirement
day.
during pregnancy?
Total iron requirement is 1000 to 1300 milligram.
1000 to 2?
कुछ बुक्स में लिखा हुआ है 1000 से 1260, कहीं 1300, कहीं 1400, वैसे एवरेज 1000 हम लेते हैं milligram during the pregnancy.
Then your
500
patient is
placenta, 500
priming
fetus,
gravida,
180 lactation.
and if she was having normal iron stores, then is it possible to enter in severe anemia
एक
in
मिनट समझ नहीं आई मुझे दोबारा.
Your patient is priming gravida.
Because this patient primary gravida and she
In priming gravida,
hello
from theory we know that iron stores are sufficient for first pregnancy.
जी.
Then why she developed severe anemia at 30 weeks gestation?
because her diet is insufficient.
Even if diet is
She
not,
belongs to poor socioeconomic status and her diet is also is insufficient with meat, fresh fruit, vegetables, and milk.
even if patient is deficient in diet and not taking oral hematinics, her iron stores are sufficient for one pregnancy. Then what is cause
इसमें
of this much severe
इसमें और
iron
तो कोई
deficiency?
कॉज नहीं बनता, लेकिन अगर मुझे इसमें एचबी इलेक्ट्रोफोरेसिस इसका हुआ होता तो उसमें एचबी इलेक्ट्रोफोरेसिस के
थैलासीमिया
ऊपर अगर उसका थैलासीमिया साथ मतलब कोएग्जिस्टेंट हो सकता था उसमें,
अगर नहीं हुआ तो फिर आपने क्या करना
तो
है?
फिर मैंने प्लान करना है ना अभी थैलासीमिया के लिए उसका वर्कअप कराना है।
Then why
मतलब
you decided that it's iron deficiency anemia?
मैं तो आपने इन जो पैरामीटर आपने मुझे दिए हैं उनकी बेस पे कहा है कि वो ये बन रहा है। अगर थैलासीमिया एचबी इलेक्ट्रोफोरेसिस होता तो फिर उसकी
Okay,
बेस
you
पे
have to
थैलासीमिया।
review all the pathophysiology of anemia again.
यस, ठीक है।
Okay, how will you manage?
हाउ विल यू मैनेज? ठीक है जी, लेट मी कंप्लीट माय इन्वेस्टिगेशन। फर्स्ट ऑफ ऑल आई विल नीड एचबी इलेक्ट्रोफोरेसिस। हेलो
हेलो, हाँ जी, आ रही है आवाज।
डॉक्टर शाजिया कहाँ चले गए? वो म्यूट है।
Electrophoresis is not done. As if it was not available 2 minutes ago, then definitely it's not available now. Either you have to manage your patient without electrophoresis or you yourself have to send.
आई विल सेंड हर एचबी इलेक्ट्रोफोरेसिस।
Okay.
ठीक है, देन गिव मी स्कैन फाइंडिंग डेटिंग स्कैन विद डेट।
Okay, dating scan was done on 15th March.
15th March।
What you need on dating scan?
डेटिंग स्कैन पे मुझे चाहिए जेस्टेशनल एज
Gestation
एंड
age, no one
एफसी।
will tell you. You yourself have to calculate.
इस पे मुझे चाहिए जो है ना सीआरएल।
CRL is not mentioned on dating scan.
सीआरएल भी मेंशन नहीं है, तो इस पे फिर मुझे
वीक्स
नहीं, वीक्स तो मैंने खुद निकालने हैं ना। सीआरएल भी मेंशन नहीं है, तो इसमें मुझे बीपीडी दे दें फिर।
BPD भी नहीं है.
फिर जेस्टेशनल सैक, तो इसमें मुझे सिर्फ जेस्टेशनल सैक से तो मैं अब फिर
जेस्टेशनल सेक्स
जेस्टेशनल
से
जो चीज अवेलेबल है जेस्टेशनल सैक।
Okay, gestational sac is 35 mm.
35 mm एंड फीटल कार्डियक एक्टिविटी
Present. जी
प्रेजेंट है,
बेटा.
ठीक है। अनॉमली स्कैन एट 20
बेटा मैं अभी फ्री
with
होके इसे सीधा करूंगी. उसे को मामा तुम्हें पूछेंगी. Sorry.
anomaly scan with date,
No cross fetal anomaly.
fetal biometry including the BPD
Sorry.
female length, fetal biometry including the BPD female length, fetal cardiac activity, placental localization, lighter volume and 4 chamber 3 vessel outflow tract on anomaly scan.
Anomaly scan is corresponding with dates and 4 chamber cardiac view is also. Might need 4 chamber 3 vessel view in this patient.
ये
वो
हम
तो
हर
क्या
पेशेंट में नहीं पूछेंगे कि किसी में तो अनॉमली वैसे ना हो, ये सिर्फ डायबिटिक में पूछना है।
वो हम क्रॉस फीटल एनोमली पूछते हैं. कार्डिक स्पेसिफिकली यू आस्क फॉर इन डायबिटीज.
अच्छा, इधर है। अच्छा, recent scan with date including the fetal biometry, BPD, female length.
Recent scan done on 20th August.
जी,
Biometry is corresponding to 30 weeks.
ठीक है।
और क्या चाहिए?
fetal cardiac activity,
Positive.
lighter volume,
AFI is 6.
5-6 and placental localization
Upper segment.
and abdominal circumference
Okay बेटा मैं
और
इसे
estimated
देख
fetal
लूँ.
weight,
Sorry.
estimated fetal weight,
Estimated fetal weight not mentioned.
abdominal circumference,
Abdominal circumference is 36 centimeter.
36
डॉक्टर को क्यों पढ़ा रही हो? उन्होंने पेपर देना है इसलिए। कौन सा पेपर? पढ़ा लूँ, बाद में बताऊंगी, चुप करके बैठ।
ठीक है। इसमें है यूटीआई, एनीमिया और ओलिगो। ठीक है
जी बेटा ये भी सही है।
देखते हैं 9 वीक।
मैं बाजार आ जाऊं। हाँ चले।
तो 9 वीक से करांगी मैं कराती
बेटा दरवाजा बंद करो। आओ मेरे पास, इधर आओ, सो लो, दरवाजा बंद करके आ जाओ।
कि डॉक्टर आसफा कहाँ चली गई?
ठीक है, इधर ही हूँ।
ओके।
आप दोनों आपस में निभा लिया।
अच्छा डॉक्टर शाजिया, आगे जाने से पहले मैंने इधर एक बात पूछनी है।
सॉरी।
हेलो, मैंने कहा आगे जाने से पहले मैं इधर एक बात पूछनी है कि जैसे हमने एब्डोमिनल सर्कमफ्रेंस से हमने एस्टिमेटेड फीटल वेट निकालना जब होता है तो हम 5 मतलब उसमें से माइनस कर देते हैं। तो अब इसका 36 सेंटीमीटर है। 36 से 5 हमने माइनस किया तो वो 31 आ गया। तो इसको आगे फर्दर क्या हमने उसमें करना है?
डिवाइडेड
कुछ
बाय
और भी इसको
10 करते हैं, डिवाइडेड बाय 10।
अच्छा, डिवाइडेड बाय 10 करना है।
और वो जो देसी तरीका है ना उसमें ये होता है कि दरमियान में पॉइंट लगा लो।
पॉइंट लगा लूं उतने
3 और 3.1 बन जाएगा ना।
हाँ जी, 3.1 केजी वेट ज्यादा नहीं है इसमें?
करेंगी तो भी 3.1 ही आएगा।
तो ये आ जाएगा 10 या 30। तो ये तो 3 केजी नहीं बन जाएगा?
हाँ
3.1 वही होगा।
3 केजी 30 वीक्स पे 3 केजी वेट ज्यादा नहीं है?
हाँ बट ये कि ये सपोज्ड है तो इसलिए ठीक है।
अच्छा
इसे छोड़ दो।
सही, चलें ठीक है। अच्छा अब दूसरी बात जो मैंने इसमें पूछनी है कि अब जैसे अब एचबी इलेक्ट्रोफोरेसिस अब नहीं हुआ, ठीक है ना? अच्छा मैंने ठीक है। एज माय पेशेंट इज प्राइमरी ग्रेविडा विद अनीमिया, यूटीआई and oligohydramnios. So first of all, I will explain the diagnosis.
And urinary tract infection.
ठीक है। Low hemoglobin.
What is definition of oligohydramnios?
अच्छा वैसे सॉरी, A56 भी नॉर्मल है, 5 से 22 नॉर्मल होता है। वो हमारे में 7 से 22 ही याद रखा। ठीक है, A56 नॉर्मल है, ठीक है।
ओके
ठीक है। As my patient is primary gravida with low hemoglobin and urinary tract infection, so first of all, I will explain the diagnosis to the couple that it is high risk pregnancy and will explain the fetal-maternal risk associated with it. My aim of management is to make her symptom free, to replenish the iron stores and to decide the safest mode and time of delivery. As my patient is presented with low hemoglobin level, so first of all, I will to type the anemia. I will go for her HB electrophoresis. And then if it is to differentiate between iron deficiency anemia and thalassemia. As my patient is symptomatic with HB of 6 gram per deciliter, and so I will transfuse 1 unit of PAC cell.
Okay.
And will, if the patient is symptom free, I will repeat her HB and also do the dietary counseling regarding she to green leafy vegetables, egg, milk, red meat, and also counsel her to avoid the excessive tea and coffee. And I will treat her urinary tract infection by giving her capsule amoxicillin 500 milligram TDS for 5 days.
Okay, you have given amoxicillin 5 days and patient symptoms are still persistent.
Then I will go for her urine culture and sensitivity.
Urine culture sensitivity
I will send her.
invalid
I will
after
send her urine
antibiotic.
culture and sensitivity, and I will send her urine culture and
You
sensitivity,
have
and
not
meanwhile
sent.
give her capsule.
You have
जी
never sent and you have given amoxicillin and patient have not responded to that. Now what will you do?
मैं वो भेज दूंगी ना.
Okay then.
I will send her urine culture and sensitivity, and meanwhile give her capsule amoxicillin 500 mg 1 TDS. And after the report
Where
of
it
urine
is
culture and
written 1
sensitivity,
TDS for 5 days.
जी
Where it is recommended 1 TDS amoxicillin for 5 days.
1 TDS में ही देते हैं वो.
Are you sure?
अभी फिलहाल तो रिसेंट तो कहीं से नहीं पढ़ा, लेकिन पहले का पढ़ा हुआ है. मुझे यही याद है कि 1
Okay,
TDS
you
में
have
देते
to
हैं हम.
confirm it from EBM, renal tract
ठीक है.
chapter.
EBM में मुझे याद जो आ रहा है वो तो
टेबल
यही आ रहा है. हाँ जी, टेबल उसमें बना हुआ है.
Okay,
काफी
then.
पुराना पड़ा हुआ है इसलिए. And also I will also give I will deform her by giving the mebendazole 100 mg twice daily
For
3 days.
okay.
For 3 days. If the patient, if on repeat HB, her HB repeat hemoglobin, her HB is 7 gram per deciliter and patient is symptom free, then I will give her injectable iron by calculating the dose of iron on alternate days.
Okay. When
By
will you
build up her
calculate
HB,
her dose?
I will calculate the dose by subtracting.
Why you have not calculated till now?
अभी इतनी जल्दी थोड़ी. 11 minus
For
6
many
और
tests,
ये
you
बन गई.
have to calculate what you have to do.
ये ऑलमोस्ट जो है ना 1400 वो बनेगी 1400 मिलीग्राम और 7 infusions.
Okay.
I will give her on alternate injectable iron on alternate days. And when the patient and will discharge the patient and will advise her to. अच्छा, मुझे अब इधर ना एक बात पूछनी थी जो मुझे कंफ्यूज कर रही थी. अब ये पेशेंट जैसे हमने इसको 7 अब देनी है ट्रांसफ्यूजन इंजेक्टेबल आयरन की, ठीक है, पेशेंट का और कोई इशू नहीं है, वो सिम्टम फ्री भी हो चुकी है, तो अब हम उसको डिस्चार्ज करके जैसे हम यहाँ पे हमारा प्रोटोकॉल है कि हम उसको भेज देते हैं और वो कहते हैं कि अल्टरनेट डे पे आके वो लगवा ले, तो हम ये उसमें बोल सकते हैं?
It's your patient and it depends on how much travel she lives from hospital and is it practical for her to come on alternate day or is it more easy for her to stay in hospital for 2 weeks.
ठीक है.
Or if she is even if she is not able to come on alternate day and she cannot remain admitted for 15 days, then what are alternate options for her?
सही.
Why you are not
As
giving
my
her
patient,
oral
फिर मैं
iron?
इधर ये मेंशन कर दूं because it is between 32 to 36 weeks we will give her injectable iron because she took oral iron in throughout her pregnancy, but she was and according to the patient she was compliant to that, but her stores were मतलब उसका her anemia was not built up with that.
And if she
So
has
because
taken and she have not responded to oral iron, then why you have not thought of any other cause? For how much time you give oral iron and if patient does not respond to that, you review your diagnosis. And why you are giving her injectable iron too much doses?
because injectable iron is we have the surety of that
What
she.
is diagnosis of your patient?
अब डायग्नोसिस तो जो है ना मेरा अगर एचबी इलेक्ट्रोफोरेसिस की रिपोर्ट पे डिपेंड करता है उस पे.
Then why